as a doctor, I really wish I had taken a few more business administration courses and economics courses in college. And then as a businessman, having the right team around you is just so important. So those are the things that I look back on and think, oh, I wish. To me, life is long, and get the word out there to have people really look inside and be like, what can I change in my lifestyle, and especially my physical self, that might help me become 60, 70, and 80 and still live, let's say, a long health span compared to a lifespan.
One that's worth it too, right? One where you don't feel like you just got to hang up your hat and sit in the recliner and watch Jeopardy.
That's a lifespan, right? That's when you are living on this earth and you were at least a non-deceased person. But a health span is living on this earth and just really doing the things that bring you joy. So whether it's staying at work, whether it's hanging out with your friends and family, whether it's dancing, swimming, golfing, whatever, knitting, sewing, cooking, it could be anything. But if you don't physically have that capacity and you mentally can't wrap your head around it, like sewing, let's say you're a great seamstress as a younger person, and as you age, you forget how to do things, you don't do them as well because your fingers are failing or your mind's failing. It doesn't have to be that way. There's certainly enough data out there about how one can embrace the health span, meaning living at a high quality as time goes on. And so, yeah, there'll be a time when everyone dies, right? And so whether you die at 80 or die at 102, you might have a little bit of influence on that.
Right. 100%. Yeah. I mean, thanks for tuning in to the Healthy Careers podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details. The habits and lifestyle that we choose. I remember my dad, gained a bunch of weight in college, and he came to me and he said, I don't care about the number on the scale, right? That's just a number. He said, but I want you to sleep well. I want you to laugh and go out with friends and not be, and be confident and to be able to do the activities that you like without fearing, what someone's going to think and it was such a key thing that he said, it's not about the outward appearance. It's about you living life and being happy with it and living each moment to its fullest because you feel good and because you've had good rest and you're rejuvenated and you're fueling your body with good things. And he said, the human body is the only machine that gets stronger with use. So, when you're at the gym and you think, I can't do another rep or I can't run another mile, you just have to think, if I do that and I'm doing it correctly, I'm strengthening myself. I'm not, going backwards.
Yeah, your dad's a smart man. For sure.
Yes.
No, seriously, because if you read any of the news, and with COVID in the recent past, which it's already like 5 years old or whatever, it goes fast, the mental health challenges after that, it just really threw a lot of the youth into a spiral downward. And so, like you said, it's about you on the inside and really loving yourself as a person and having the knowledge and doing those things to make you continue to love yourself as you age. Whether it's excelling at school, whether it's learning a trade and really kind of devoted to it. But ultimately, you got to look in the mirror and be like, I like who I am. I like what I see and who I see. And hopefully your thoughts are also aligned with that. Meaning you're not just walking down the street paranoid or sad or scared or something, but rather you're like, oh man, I can't wait till these couple days till my next fun time with my friends or my family, or even I love the challenge of being tested, like at school. I'm going to rock this thing. I'm just going to do as best I can because I prepared well, or go to the gym and then, like you said, in the right technique and just listening to your body and feeling good, getting those endorphins to flow after you raise your heart rate, and just listening to your body, though, is so important. And I tell that to my nieces and nephews or my family or my parents. I'm like, guys, slow down. You got to rest, you got to hydrate, you got to eat well, and you got to do things in right technique. And so don't go for that extra thing if it's going to hurt you. If you have to lift that heavy box, you better know how to lift it. All you need is your back to go out on you, and you're like done for like a week. And then the inflammation sets in, and then it's all of a sudden 6 weeks, and you're like, when is this ever going to go away? So moving from acute injury to chronic injury is something that I think, and I totally think that if you know what to do with an acute injury, you will overcome this and it will not go down that road to chronicity. And chronicity, in my mind, is something that happens acutely, meaning all of a sudden, and at 3 months, it's still around. It's still part of your life. And so when you're tossing and turning in bed because your knee still hurts or your ankle still hurts or your shoulder or your back, like, man, when is this ever going to go away? It's been 3 months. What the heck? So I think there's a ton of things, or there's many things that people can do in the first 3 weeks after an injury to really kind of get them on the road to a faster recovery.
100%.
And I've tried to crack the shell of the injured workers in the workers' compensation world, because unfortunately those guys, a couple bad apples kind of ruin the whole kind of outlook and say, oh, yeah, I twisted my ankle at work. Yeah, right. Sure you did. You just want to stop working because you don't like work. And so that's a struggle, because now everything has to be vetted and tried. And all of a sudden it's 4 weeks before they get to see a doctor or have physical therapy. And if anybody knows, after acute injury, the inflammatory process involves swelling, redness, stiffness, warmth, maybe tearing or bruising of tissues. It's going to bleed on the inside, and then your body's going to create this thing called scar tissue. So unless you do something about it in the first week, even the first hour, frankly, but if you think of a professional athlete that gets hurt on the field, they get an MRI the next day. I'm not saying that at all is the right thing to do, but these guys, their whole livelihood is based on them being on the field. But they're also getting the ice and the elevation and the compression and the ultrasound and all those things, and then a trainer, and then starting to do some exercise within 2 days after their injury. They just are. I worked with Temple University, as a sports medicine fellow. And so, and I also just have been around enough to know that the elite athletes get treated differently when it comes to musculoskeletal care. And part of my mission, of course, is just to bring the industrial athlete to the forefront when it comes to, like, okay, let's get them the care they need so they can become part of the team again. They can have less lost time from work, maybe have less opioids, maybe have less surgery, maybe be able to go and back to work instead of sitting on the sidelines, getting comp disability at 15 or 50% of their normal pay, and then never go back to work if they've been out more than 9 months. And that's what happens.